All right. Well, good afternoon, everyone. Thank you for joining the mini community pharmacy more profit roundtable. I'll be your host this afternoon. My name is Breck Rice. I've been a community pharmacy advocate now for over 20 years. I love the industry. Will do everything I can to help community pharmacies be successful. One of the areas that I help in is with PBM reform, PBM reform podcast on the Pharmacy Podcast Network. We talk to lawmakers and other decision makers to try to make positive changes, and it's a really slow process. But we do make progress. I feel sometimes like a little guy in a rowboat with a hammer and chisel, chiseling away at a big iceberg before the boat runs into it. And even though we're making progress, that Titanic's still going to smack right into it, unfortunately. So sometimes I feel like it might be better to bypass the iceberg entirely, or in this case, bypass the PBMs. So that's why I host the other podcast series that I mentioned earlier, and that's the Community Pharmacy More Profit Roundtable. This live podcast is only once a month. However, I do a mini version of that every week at this hour. So every Wednesday afternoon at 4:30 Eastern, 1:30 Pacific time. And welcome anyone, and certainly love to have community pharmacies here to learn more about all of the clinical services that are now available to be presented through community pharmacies. So it's an exciting time for community pharmacy to expand their scope of services and not just depend on dispensing revenue. You really can't make a living any longer at your pharmacy just dispensing medications. Back several years ago, the profit margins were better. You could make, 20, well, even as much as 35, 36% profit margin. Today, our community pharmacies are lucky to be getting, 3 to 5%. In fact, about one-fourth of all the medications dispensed at a community pharmacy actually walk out the door below the acquisition cost of the medication. So that's really hard to stay alive if your profits are walking out the door. And unfortunately, that is because of the PBMs we talked about earlier. So if you could bypass the PBMs to do more things in the clinical side, then that's going to be much better off for your pharmacy. And it's also going to be a convenience to your patients. So that's the very reason why Remote Care Today reached out to me. The Vice President of Sales and Marketing, George Veronis, was just got back from traveling today, so he won't be able to join us. Normally, I have him in on the mini roundtable to tell us more about the RTM program that's rolling out. This is brand new for community pharmacies. I'll share the information with you this afternoon. But in these three buckets here, chronic care management, remote physiological monitoring, and remote therapeutic monitoring, these are the three buckets that remote care today operates in. And so when George reached out to me to be on the podcast to help educate community pharmacies, after I learned what the opportunity was here, it was a no-brainer for me. Every pharmacy should enroll in this program and get set up because you're going to be able to help your community, especially your seniors in your community, in a way that you've never been able to help before. And even though we'll focus on seniors, this program actually works for commercial payers too. So it's basically case by case. Any patient that may have a musculoskeletal disorder or even possibly a respiratory issue might qualify case by case on the commercial side. Almost every patient on Medicare will qualify for this program. Now, we start with remote therapeutic monitoring. They're the new kid on the block because it's the easiest to get set up for pharmacies. You can expand into chronic care management and remote patient monitoring or remote physiological monitoring, but that requires a collaborative practice agreement with the providers who are prescribing those services. It requires being in network with the payers to be able to bill on your NPI. Those are requirements that are not needed with remote therapeutic monitoring. This is a complete turnkey solution that all of the heavy lifting is done by remote care today, and the pharmacy can participate in that. at no cost to the pharmacy. So that's the other reason why we talk about starting with the remote therapeutic monitoring. The first CPT code to be covered by Medicare was clear back in 2015, and that's the CCM CPT code. And then in 2019, the RPM was added. And then, like I mentioned, the new kid on the block is this remote therapeutic monitoring. And it came out 2022, 23. But this is the first time it's being offered through community pharmacies. So this is a really exciting time for community pharmacy to participate in this. Now, I've outlined 3 steps for successfully doing clinical services because yeah, as I've done my podcast over the last couple of years, I've been talking a lot about community care and how pharmacies can get involved in clinical services. But I can assure you there's more wrong ways to do it than right ways. And so we want to help pharmacies navigate the right way or the correct way to get more involved in clinical services. And it starts with step one, which is therapeutic monitoring. Um, the again, no cost to the pharmacy, no additional staff needed. It's a very turnkey solution that we'll spend a lot of time talking about this afternoon. I just want to touch on step two and step three because so many community pharmacies are interested in learning how to properly do medical billing. So, Remote Care Today has a Brain Health Plus program for pharmacies. They have partnered with IPPN, which is the Independent Pharmacy Provider Network, in order to expand those scope of services that we talked about. That is doing medical billing, and there's some quick solutions where pharmacies can get involved right away. There are some setup costs to that, though, so I want to be straightforward and make sure everybody understands that there is a cost to doing step two and step three. Now, you may, as a pharmacy, decide to never take step two and step three, and that's totally fine. That's completely up to you. But this is the progression. And you can't do step three, which is a full brick and mortar HIPAA compliant clinic or clinical room inside your pharmacy. You can't do step three without step two. Those go hand in hand. Again, don't ever have to do step two or step three. You can just do the RTM program and do really well. Just want to make that perfectly clear. Excuse me. So the remote therapeutic monitoring covers, like I said, musculoskeletal disorders, respiratory, and then even some medication management. So you can see that the symptoms there in the middle are very broad. Almost every senior is going to qualify. They're going to have pain, stiffness, weakness, one of those symptoms. So it's pretty easy for a patient to qualify, and then the outcomes are tremendous. It's addressing the main concerns that most seniors have, which is loss of memory and loss of balance, and helping seniors stay independent longer. So the studies that have been done, the medical studies that have been done on remote therapeutic monitoring already just in the last 2 years are outstanding, and I'm excited to share some of those results with you today. Why is Medicare really pushing this program? Well, it's because the leading cause of injury-related death with seniors is still falls. They're spending over $50 billion a year to address falls in seniors, and they're projecting that that's going to double in the next 5 years. Cognitive impairment is a big contributor. There's a study that shows that patients with dementia are 300% more likely to have a fall. I was just on speaking with a pharmacy partner back in North Carolina just last week, and unfortunately, his own brother-in-law has dementia really bad, and he had a fall, had to have a hip replacement. And unfortunately, he's had multiple falls after that because he forgets that he's had a hip replacement. And so he'll just get up and want to take himself to the restroom without using the walker, and he falls down again. So it's a really sad situation. On the cognitive side, seniors in their 70s, two-thirds of them are experiencing some kind of cognitive decline. And now every minute, a senior is diagnosed with Alzheimer's disease. The clinical outcomes for this program with remote therapeutic monitoring are amazing. Like I said, it is delaying or even preventing dementia by 5 to 8 years. In fact, there's a study that shows that patients that are involved in remote therapeutic monitoring are 75% less likely to contract dementia. So that's an amazing statistic there. So I want to share just a quick 2 minute overview of the Brain Health Plus because it's very comprehensive. There's a lot of information in there, and I want to have the video explain that because it can do a better job than I can. So let me play this for you.
As an independent pharmacist, you already know your patients count on you. And with reimbursement challenges and tight margins, finding new revenue streams that actually help your patients is more important than ever. That's why we're happy to introduce you to Brain Health Plus, a remote therapeutic monitoring program, RTM, covered by Medicare Part B and most Medicare Advantage plans, designed to improve memory, balance, and cognitive function in just 5 to 10 minutes a day. It does this with fun exercises and games that stimulate the brain, increasing neuroplasticity. Your patients can access Brain Health Plus from their smartphone, tablet, or computer. It's a one of a kind RTM platform that offers engaging, fun, and clinically proven activities to improve cognitive health, prevent falls, and helps your senior patients stay independent longer. We're talking about daily brain games, interactive motion sensing exercises, motivational health content, medication management tools like being able to scan your medicines right into the system, reminders of when to take medicines, potential drug to drug interactions, and even geofencing alerts. So loved ones are notified if a patient visits the ER or hospital. Every patient also gets a 30-second biometric facial scan they can do at home so they can scan their face and track their health as often as they wish. This amazing technology lets them track important health vitals like blood pressure, heart rate, and oxygen levels with 96% accuracy. Done with a smartphone or even a computer, it keeps patients motivated and engaged without replacing their medical care. And here's the best part, we do it all for you. You get a fully turnkey solution, flyers, posters, bag stuffers, and patient onboarding handled entirely by us. We even do all the Medicare billing. No added staff time, no upfront cost. In fact, no cost to you ever. Just real results for your patients, such as a clinically proven decrease in falls and better memory. And you can earn administrative service fees for simply reviewing monthly patient progress reports for each participating patient, which will significantly add additional profits to your bottom line. Brain Health Plus, easy for you, powerful for your patients, and great for your pharmacy.
So very comprehensive program. As you can see, some of the key points I really love about the platform is the geofencing that will notify loved ones when, a senior ends up having to go to the emergency room, even without a phone call. That biometrics, getting your blood pressure, heart rate, oxygen levels all through a face scan is really cool technology. I've played around with it before, and it's scary how accurate it is. Not to replace an actual, nurse or someone taking your vitals, but it gives a patient a really good benchmark, and that'll be provided to not only the patients, but your pharmacy will have access to that as well. So it's a great patient engagement tool. So, as mentioned before, this program is covered by Medicare Part B and most Advantage plans. We realize most of our pharmacies are not in network with Part B, you're in network with Part D, but you don't need to worry about that because that's all taken care of for you by Remote Care today. They're billing on their NPI and they are in network with Part B. The one of the tools in this that is really taking the country by storm is this Ludafit, and a sister product to this is already being utilized in over 500 rehabilitation centers nationwide. And this is just one of the tools on the Brain Health Plus platform. This one just happens to have the most clinical studies backing the benefits of this. And I love this testimonial from Paul down in Tucson, Arizona, because he's 89 years old and he tells you right out front that he hates to exercise. So even though he doesn't like to exercise, he'll still do this because it's just really fun.
My name is Paul Tony. I live in Tucson, Arizona. I just turned 89 years old and I hate to exercise. When I had the opportunity to try Ludafit, I found it fun. I enjoy it. I enjoy it because it's a game, and psychologically, I know that it's benefiting me. You move, and the avatar, that is a figure that represents you on the screen, it moves along with you. And it's fun. You hear the shushing of the skis through the snow, and you see obstacles in front of you. You try to avoid the obstacles. And my very favorite, even though it's probably the most strenuous, is the Thai rock climb. What you're doing is climbing up a mountain path, and not only are you sidestepping, but along the path there are rope ladders. And in order to climb a ladder, you reach your arms up and you just keep moving. My kids saw me exercising and they wanted to try it. And they were laughing, and, and it comes with a lot of giggles anyway. Initially, when I first started it, I had to hold on to a chair. But I found that repeatedly doing the exercise, I got confidence in letting go of the chair. So right now I do it freestanding. Bottom line, I'm sold on it.
So a couple things that I love about Paul's testimonial there is that um, he used to have to hold on to a chair to balance himself, and now he doesn't any longer. So it's a proof that muscle atrophy can be reversed. It's also it's really funny to me that he talks about avoiding the obstacles as he skis right through the boulder. And then it was actually his grandkids that were testing this out, and they were on purpose running into the bikes to knock people off of their bike. They created a new sport out of it, but it was really kind of a fun demo. But all of the marketing and patient education will be provided to your pharmacy free of charge. There's never a cost to the pharmacy. There will provide posters, rack cards, even print the information on the prescription bags and provide the bags for you. And again, never any cost to you. They will help with as much of the patient education as you want them to, utilizing your pharmacy's own communication system. So if you do text reminders or vaccination, immunization reminders through SMS or any other outreach, they will do the same thing, but through your own pharmacy systems, or they can just help you set up those messages to go out to your patients as well. Even if a friendly phone call is made, it'll show up on the patient's caller ID as your pharmacy. So never a third party that's engaging. It'll always be coming from the pharmacy to invite them to come to your landing page. So they set up your own website for your pharmacy, which is the landing page that you direct patients to. And then that has all of the testimonials like we just saw from Paul. It has all of the educational information that's needed. And then when the patient clicks, the enroll here, that's when they'll get connected with a care coach that will walk them through all of the setup for them. Most of your patients won't even have a copay on this. They're either dual enrolled or they will have a supplement plan that goes along with Medicare. About 85% of them. But for the 15 to 20% that do have a small copay, they'll know that up front. So there's no surprises. So that's another amazing benefit is how well they handhold the patient through the onboarding process. So again, a very unique platform, the first time that it's ever been offered through community pharmacies. There's already hundreds of pharmacies already in the queue for onboarding. So it's really an exciting time for community pharmacies to get involved with this. You will get the biometric facial scanner for your pharmacy as well. and they're anticipating a really strong enrollment of 70% or more with this program. So, what is the pharmacy's responsibility? Well, other than helping to direct your patients to your own landing page to hear how they can stay independent longer and delay the onset of cognitive issues and have better balance, there is a requirement to do a review, a once a month review. So any patient that enrolls in the program will have a month worth of exercises, just as the video said, only 5 to 10 minutes per exercise, basically every other day. So in order to be covered by Medicare, they need to do 16 engagements. If a patient misses a day or two, not your problem. Again, it'll be completely managed by the care coach. Will be the one that reaches out to them, get them re-engaged. But they love to do the exercises. There'll be a lot of other fun things too, where they can compete against their peers of who climbed the mountain the fastest or who skied down the hill the fastest. But the review will then be due after that 16 engagements for a month. And then it should take you less than a minute per review. This 30-second video here shows you exactly what you do for the review.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
So again, it really is straightforward, and being able to do those reviews shouldn't take you more than a minute. Basically, what you're doing is it's a checks and balances. So Medicare allows that an administrative fee be paid to make sure that the patient is continuing to show progress. If they, plateau or start to dip in their progression, you simply notate that, and then that alerts their care coach to adjust the program. Every program is customized to the patient's ability. There'll be a baseline check, and then you want to see progress after that. Most patients stay on the program between 8 and 18 months, and they can actually graduate off the program, but then Medicare allows them to re-enter the program again because they just know how valuable it is. So again, all the patient education will be provided for you. The patients click the enroll button, and Remote Care Today takes over from there. The the administrative service fee is $25 per patient per month. So if you have 100 patients on the program, that's $2,500 for the month. That 100 patients should take you less than 2 hours worth of review time, and it can be done, after hours, or at a slow time during the day when you don't have patients that are waiting, or it can be done on a Sunday afternoon before the work week starts. So it's pretty easy to fit in when you would do that review, and not a bad return on your time, for making about $1,250 per hour in doing those reviews. So it's an amazing opportunity. Like I said, that hundreds of pharmacies are already enrolling in, and you'll want to get into the queue for your onboarding sooner than later. This last little short video I want to play for you is basically recapping everything we just discussed. What are the next steps? To get started, your next steps are easy. First, complete our agreement and sign the BAA, which ensures HIPAA compliance, and then we'll schedule your onboarding meeting. During this meeting, we'll show you what we mean by a turnkey solution. We'll discuss how we engage patients and the materials we can print and provide you that help patients engage with us. We will then educate and onboard your patients using approved text messages, emails, and friendly phone calls, providing the patient the appropriate programs and coaching, all without any cost to you. And don't forget, you can earn monthly administrative service fees by reviewing your patient's progress. It's about better care for your patients.
More profit for your pharmacy, all with a zero out-of-pocket investment. Let's get started.
All right. So the next thing that I wanted to share with you, this is a separate demo. So if you do have interested in expanding your scope of services into more medical billing, then this would be to set up a time to go through that information with the Independent Pharmacy Provider Network, which, by the way, is the fastest growing community health collaboration in the country. Now in 18, 19 states, several hundred pharmacies that are in the network, and several thousand doctors that are in the network. Why are the doctors joining the network? Because there is a shortage of primary care providers, and so there are care gaps in service. This program fills those care gaps. It's really a win-win-win. The patient wins because they have easier, more convenient access to care by going to their community pharmacy. And they don't have to wait around for weeks or months to get in to see their primary care provider. Well, the primary care providers still win because they're still managing the care plan. That's still their patient, and so they still manage the care plan and they get compensated for that. Filling those care gaps also improves their quality measurement scores so that they now are getting a more fair reimbursement on the services that they do perform. So it's a real big win for them. But the biggest winner is the community pharmacy because on average, 67% of all the bill charges stay with the pharmacy. It's an amazing program. This program turns things like immunization, like a flu shot that you're normally only getting a $17, $20 reimbursement from the PBM on, turns it into a clinical visit or a preventative health visit with an additional $85 reimbursement. Also, today, out of the kindness of their hearts, our community pharmacies are helping patients get set up with their continuous glucose monitors. Well, thank you for doing that. But in this network, you would actually get compensated for that consult, anywhere between $50 to $150 per month per patient. So, a very exciting opportunity for pharmacies to join the Independent Pharmacy Provider Network. Last is the full brick and mortar clinic called Brim Wellness. This is um, a program that you can certainly do only after you do step two. So you have to be in the network um, with IPPN first before because you need the collaborating practice agreements. Um, you need the be in the network with the payers, which is what you accomplish with IPPN. But the three legs of this stool are very simple. First leg is all of the managed services. It's the setup of your clinic and managing of your clinic. The second leg of the stool is the talent exchange. You have post a shift, it's filled by a healthcare provider. So it's kind of like Uber for medical staff. And then the third leg of the stool is what I'm most excited about. It's a financial vehicle. Not only does it help you set up your clinic, but when you pay back the pharmacy fund, you become a cooperative member of the fund. So not only are you helping the next community pharmacy set up their clinic, you're also earning interest on that fund. So, wanted to share that with you today. If you do have any questions about any of these programs, I'm certainly here to help any way that I can. Appreciate everyone being here, but that is our demonstration for today. If you are a community pharmacy, please get with the care consultant that invited you today so that you can figure out how to get your paperwork started in order to be able to get enrolled with the remote therapeutic monitoring program. But I do appreciate everybody being here, and I look forward to helping you any way that I can.